Hello friends, I am Dr. Manish Madhav, and in continuation with our discussion with Phimosis, today we shall be discussing about what are the various treatment options that we give to our children who present with phimosis. Mind you, these phimosis are the pathological ones and not the physiological one. So the first and foremost that we do is giving the choice of a conservative option. Now here what we tell to the parents is make the child sit in lukewarm water for a period of 15 to 20 minutes. Get the child out of water, make him lie down gently, retract the prepuce, and we give a special steroid cream which should be applied in the retracted part. And we ask them to repeat this maneuver twice a day for a period of 1 month. And we ask the parents to get back the child and we examine again. Around 60 to 70% of the children respond to this method and will not require any surgical correction. Okay, now the second thing that we give is the surgical option. If the child is not responding to the conservative means, what do? We give the surgical option. Now, surgical options can be of two types. Now, basically, what happens is this is the penis, right? And this is the foreskin of the penis. This is the urethral opening. Now the child is supposed to pass urine, and the urine should be coming out directly. Now what happens in phimosis is this opening is too small. So the urine accumulates here. There is ballooning of the prepuce, and the urine is in contact with the prepuce for a long with the glands for a long time. So there are two options that we give to the parents. One is removal of this foreskin in entirety. We remove the entire foreskin, and it is again a daycare procedure. It hardly takes around 15-20 minutes of time, and we discharge the child on the same day. Now the other option that we give is, as you have seen, I have drawn two layers. The foreskin has two layers, the outer layer and the inner layer. This tightness is primarily because of the inner layer. Now here what we do is, when we understand this physiology, what we do is we operate in the child in such a way that this inner foreskin elongates, so it becomes loose, and the child and the foreskin can be retracted fully back. Now this procedure is called preputioplasty. Now again, there are certain advantages and disadvantages of both the procedures. Circumcision, the main advantage is, since the foreskin is removed entirely, it will not come back. So the chances of recurrence after the surgery of circumcision is practically nil. Now, what are the disadvantages? Obviously, the shape, the appearance of the penis will change. The foreskin is absent, the glans is exposed. Mind you, it is not a deformity, it is just that the appearance of the penis will change. And another thing that we as pediatric surgeon take care of is, this foreskin has a lot of sensitive nerve fibers, and there are certain studies which say that the nerve fibers in the foreskin has some role in sexual function also. So we as pediatric surgeons give this option of preserving this foreskin. So that brings to the other option, that is the preputioplasty, where we elongate the inner foreskin. Now in this procedure, the main advantage is the appearance of the penis remains the same. The foreskin still covers the glands, and the child is free of the symptoms also. Now the disadvantage is, after the surgery is done, we teach the mother how to retract the prepuce and to apply certain creams. If not done properly, there is a chance of recurrence. So we give this option to the parents whether they want to go ahead and do preputioplasty or circumcision. In either case, both are standard procedures and can be done on a daycare basis. Thank you.